My name's Garrett. I'll be your intern today. What brings you in?
I'm having trouble seeing.
Having trouble seeing? And how long have you been having trouble seeing?
About a few months.
A few months. Okay. And is there anything that makes this better?
Squinting.
Squinting helps it? And does anything make it worse?
Nighttime.
Nighttime? All right. And how would you describe this trouble seeing?
Blurry.
Blurry? Okay. Is it all the time?
Pretty much.
Okay. Would you say this is in one eye or two eyes?
Both eyes.
Both eyes. And on a scale of 1 to 5, 1 being just a nuisance, 5 being it really hinders your day-to-day life, how would you describe this blurriness?
About a 4.
A 4? And you said it was all the time, so when does it start to occur for this blurriness?
Like during the day?
During the day, yeah.
In the morning, usually.
In the morning and last all day?
Mm-hmm.
Okay. All right. And are you experiencing any near blur with this?
No.
All right. And when was your last eye exam?
About 3 months ago.
3 months ago? And who was that done by?
Dr. Jones.
Dr. Jones. And were you dilated at this last exam? It's where the drops in your eyes to make your eye pupils bigger, and you're real sensitive to light. They won't, you know. Do you know when the last time you were? No, you don't know. Okay. All right. I see you're currently wearing glasses. How old are those?
About 3 months.
3 months. And how long have you been wearing glasses altogether?
Since I was little.
Since you were little? So would you say majority of your life?
Yeah, like 20 years.
20 years. All right. And do you wear them all day long?
Yes.
Okay. And are they for near or distance?
Distance.
Distance. All right. And are you currently wearing any contacts?
No.
No. Have you had any trauma to the eye or head? Have you had any surgeries on the eye or head?
No.
Have you had any visual training, such as a patch over the eye?
Yes.
Okay. And when did you experience this, or did you have this patching?
When I was younger.
When you were younger? And how long did you wear this patch?
Several months.
Several months. And did you have any issues after that, after you had the patch taken off? All right. Have you experienced any diplopia, which is double vision?
Mm-mm.
Any halos, which are rings around lights? I'm sorry.
No.
About photopsia, which is flashes of light in your eye?
No.
About any floaters?
Yes.
Yes? And how long have you noticed these floaters?
Forever.
Forever? And do you know any time that it's associated with certain activities or certain time of the day?
When I'm looking at things that are white.
Looking at things that are white. And how would you describe these floaters?
Little squiggly lines.
Little squiggly lines. And would you say this is in one eye or both eyes?
Both.
Both eyes?
But more in my right eye.
More in your right eye. And when they do occur or when you notice them, how long does it usually last?
It just depends. They come and go.
Okay. And when was your last physical?
About 6 months ago.
6 months ago. And do you remember who was the doctor that performed that?
Dr. Smith.
Dr. Smith. And what do you see Dr. Smith for?
Just a checkup.
And was your blood pressure taken at this? Okay. And do you remember what your blood pressure was?
120/8.
Oh, that's pretty good. And did they take any blood sugar?
I'm not sure.
Not sure. Was your cholesterol taken?
Yes.
Yeah. And how was it?
So that was good.
It was good. And how would you describe your overall general health?
Good.
Good. And have you experienced any fatigue?
A little bit.
A little fatigue. And how long has this been going on?
Just a couple weeks.
Just a couple weeks. Do you notice it associated with anything? Okay. And have you had any fever?
Mm-mm.
Have you had any bodily surgeries?
Nope.
Any trauma? Any recent extreme weight gain or weight loss?
No.
And are you currently pregnant or nursing?
Nope.
No. Okay. All right. And do you have any known medical allergies?
No.
How about any known environmental allergies?
Yes.
Okay. And what is that?
Just seasonal stuff.
Seasonal stuff. And when you get these, when you have your allergies, what is your symptoms?
Just like a headache.
A headache. Do you take anything for this?
Ibuprofen. Stuff over the counter.
Over the counter? And are you currently taking any prescribed medicine from the doctor?
No.
How about any eye drops?
Mm-mm.
And you said you were taking over-counter ibuprofen. How often do you take that?
Just when I need it.
When you need it? And you said it was for your headaches and for your allergies. What's the dosage that you take?
I just take 3 pills.
3 pills. Okay. Are you having any side effects or anything like that? So now I'm going to ask you some family history. Actually, I'm going to go back in your second. Did you have any experience any headaches with your vision? How about any seizures? And so with your family history, have you, I'm going to ask you some ocular family history. Have any family members experienced have any glaucoma, which is increased eye pressure, intraocular eye pressure?
My dad has.
Your dad has. And when did he experience this?
I think it's 50s.
And what is he taking?
Just eye drops.
Eye drops. And would you say it's pretty well controlled?
Yes.
How about macular degeneration, which is the loss of central vision in a person? How about blindness? Any retinal detachments, which is where the back of the eye separates?
No.
How about any eye turns or lazy eyes? I'm going to do some systematic diseases in your family. If they apply to you or your family member, just say yes or no. How about any cardiovascular issues such as heart attacks, hypertension, or heart diseases?
No.
Okay. Any respiratory problems such as asthma, wheezing, or bronchitis? Endocrine issues such as thyroid issues, cholesterol, or diabetic.
My aunt had thyroid issues.
Thyroid issues. And is this your dad's sister or your mom's sister?
My dad's sister.
You said thyroid, correct?
Mm-hmm.
And when was she diagnosed with this?
In her 40s.
In her 40s. And is she taking any medicine or what is she? Just
prescription pills.
Prescription pills. Okay. And would you say it's pretty well controlled? Yep. And have you had any family members with chronic ear infections, sinus issues, or sore throats?
No.
Any neurological disorders such as Parkinson's, seizures, or dizziness?
No.
How about just common general health issues such as fever, fatigue, or any weight gain or weight loss? Any blood disorders such as trouble clotting, swollen lymph nodes, or anemia?
Mm-mm.
About any GI issues such as stomach ulcers, stomach pain, or nausea?
Nope.
Muscle skeletal disorders such as arthritis, rheumatoid arthritis, or muscle weakness?
Mm-mm.
How about any skin disorders such as melanoma, an abnormal mole or freckle, or rashes? Does cancer run in the family at all? All right. We're going to ask you a couple questions about them just to get to know you on your personal level. What do you do for a living?
Social work.
Social work. And what is the reading demand you have every day? How many hours a day do you read for general work?
5 to 6.
And I'm sure you're on the computer. How often are you on the computer?
About 5 to 6.
5 to
or
6
longer.
or longer. And what do you like to do on your free time?
Be outside, walking my dog.
Be outside walking the dog. And do you smoke or chew tobacco?
No.
How about drink any alcohol? And do you use any recreational drugs?
No.
Okay. All right, I'm gonna go over through what we've gone through, what we went, just what I checked off on this. I have you coming in because you're having trouble seeing. Started a few months ago, and squinting makes it better. It's a little worse at night. You're blurry all the time in both eyes, and it happens. It starts in the morning, lasts all day. And you did have some visual training with patches when you were younger, but nothing has happened after that. And you did say you had some floaters. They've been there for a long time. There were little squiggly lines. It was in both eyes. Your right eye was a little worse than the left. They come and go. Your last physical was 6 months ago with Dr. Smith. Your blood pressure was good. Everything was good. Your overall health is good. You did say you had a little bit of fatigue. Started a couple weeks ago, but you don't see any association with certain things. That's okay. You did have environmental allergies of seasonal. You take over-the-counter ibuprofen. You take that when needed. And you did have an aunt that has thyroid issues, and she's pretty well controlled. And your dad has glaucoma, and he's pretty well controlled too with drops. You're a social worker, pretty heavy reading time and computer time. And was there anything else I missed that we didn't go over that you'd like to let me know now?
Nope.
All right. Thank you so much, and you have a great day.